everyone. I thought that today I would say hello. Oh, I just wobbled my screen. We have some new technology. We have better mic. We have hopefully better lighting. People were like, we need to see your face. So can you see my face? Anyway, I'm really being brave. Today I'd like to talk to you about diagnosis and the importance of having a diagnosis. So if you're seeing a medical practitioner or an allied health practitioner or somebody who has a degree that gives them the ability to diagnose, demand a diagnosis. Talk to them about a diagnosis. That word, that can be scary. Diagnosis? What's a diagnosis? Well, I can only give you my perspective of a diagnosis as I've learnt it and as I apply it to my patients. But I need something. I need a theory. I'm a scientist. I am a scientist. Osteopaths learn science. There are many health practitioners that learn a science, and we need to apply this science to our business, to our practice, and to our patients. It keeps us safe. If we have a diagnosis, we have a treatment plan. Without a diagnosis, we don't have a treatment plan. Without a diagnosis, we don't know what's going on. Without a diagnosis, we don't know if it's safe to treat you. We don't know if you are our ideal patient. You don't know if you are our ideal patient. You don't know if we are your practitioner. If you don't have a diagnosis and you can't get a diagnosis, you need to refer. Osteopaths are really lucky. As I said, I can't speak to a medical diagnosis. I cannot diagnose a medical condition. I can propose an idea of a medical condition. I have the knowledge to rule out or to explore within myself medical conditions in my patients. I do not have the ability to give them a medical diagnosis. A doctor with a medical license does that. So medical diagnosis is really interesting. I learned from a great doctor at uni about medical diagnosis, and it's a really interesting process, which I'll give you a tiny bit of that so that you understand. So the medical model in Australia has a really interesting system of you present to first level of care, which is usually a GP, and they have a chat to you and they figure out if they can come up with a diagnosis, which might involve some tests, it might involve just talking to you, and that the diagnosis for them has to fit into a really set box of symptom pictures and then test results, and they put that together. That's a diagnosis, and then they test the diagnosis by treating you. And they've been doing that a really long time. So that's a system. If your GP cannot get a diagnosis, they refer to a specialist to try to get a diagnosis. And if that specialist can't diagnose you, they refer to a different specialist. Now, in some situations, that becomes very tiring, and that becomes it feels disjointed. And it would be really nice if the medical people had the time and the ability and the funding to catch up, and if all the specialists could get together and chat, would be good. Anyway, I'm here to talk about osteopaths, and I'm happy for other allied health professionals to talk to me about how they diagnose. I'm happy to interview any practitioner about the way they diagnose in their model. Wouldn't that be amazing if we could all share that model? I know some chiropractors who have great diagnostic models, physios who have some great diagnostic and treatment models, many other people. And we are actually all friends. We don't fight. We just have heated discussions sometimes because we come from different ways of thinking about the body, because the body is complicated. So if we all just thought about it the same way, not many people would fit into that limited model. So the osteopathic patient has a diagnosis around function and around health. So when I'm treating an osteopathic patient, I'm looking at what's healthy. I start with breath usually. Where are they breathing? So that's led me to be very excited about a breathing model that I use. I use my breathing model in my diagnostic testing, in the way I speak to a patient, in the way they speak to me. I'm examining the way they breathe every time they speak, when they cry, which they do, with all of their actions and with everything they tell me. Sometimes I hear their story that led to them being here, their story that caused pain or trauma or dysfunction. And I think, when did they stop breathing? And then we look at that part of the body and we just get that body breathing. So that's my diagnosis and approach. Now, the diagnosis is a guess. That's the secret. You have to be brave enough to grab all of your clinical reasoning. And Dr. Still, the first osteopath, really focused on this. He wanted us to treat everybody as individuals, and this is 1900 America. We had to be brave enough, strong enough, and knowledgeable enough to have a guess based on our reasoning and our clinical experience, which, I'm sorry for new grads, I was a new grad once too, and because you don't have the breadth of clinical experience, you haven't seen it all happen, then you have less diagnostic ability. So at the start, so that everybody understands the process of experience, at the start, I gave myself 4 treatments to have a diagnosis. And if I didn't have a diagnosis in 4 treatments, I referred either to a colleague, that might have been just a chat, or I referred outside the model of osteopathy to somebody else. Now, if I saw something that made me think, this is out of my scope, I'm concerned that I am not able to diagnose and help treat this patient, then I would refer quicker. So red flags, we don't need to talk about what they are, but we all learn certain symptoms and certain presentations, and we say, red flag, uh-oh. Good practitioners will think red flag and won't speak red flag. Good practitioners will say in their mind, that's a very interesting little thing that I just heard. And they will stay completely calm, because we have to gather as much information as we can, so that if we are referring, we can send that away and the next person has more information, and we're building a beautiful picture. We also treat to that picture. Now, osteopaths, listen. When you refer, you are not handballing. Sometimes we have patients that we handball because we get scared, they're out of our scope, they're not our person, that's okay. Handball is good, but referring is not handballing. Referring is building a team for your patients. Referring is saying to the patient, I've got a working model for you. I have a working diagnosis today. After 22 years of experience, I hope to get a working diagnosis in 1 or 2 treatments. 1, preferably. And I know on the second I've tested, so I have a working diagnosis in the middle of the first treatment. I have a treatment plan. I treat, I give advice. I ask them to go out and test my theory. They call me or they come back. If I'm wrong, they call me. You got it wrong. I'm in pain. I'm worse. I'm blah, blah. That is good information. Take that to your practitioner. Don't take it to another practitioner. Take it to that practitioner. They're collecting information. Sometimes that scares us. I didn't help them. I got it wrong. But we're human. We're all humans. Your specialist, your medical specialist, doesn't look like a human because they're so put together. I come to work and I'm told that I look like I'm so put together. Ask my family if I'm so put together in the morning. No. Give me coffee, then I'll be kind of put together. Get in the car, drive to work, more put together. Breathe, Alyssa, breathe. This is passion. I'm so passionate about this. This is the start of a really good topic, I feel. We need a diagnosis. There's a system in place in Australia with so many practitioners with different diagnostic skills that we can all put together. I just spoke to a really great specialist the other day, and this is a medical specialist, pain management specialist, and he said that his patient, he thought MRI, he gets MRIs for his patients to get to know them, because he looks at MRIs way better than I do. I love x-rays, but MRIs are very confusing for me. So that's what he does. But then he had a patient who had such a clear presentation that he said, let's not put the patient through a test. I feel really confident that this patient is on track, but we'll watch this patient, and I will watch this patient, and other people will watch this patient. I, as the osteopath, will watch this patient, and other people will watch the patient. And we work out whether we've got the diagnosis or not, because the specialist didn't see any red flags and was happy. Get a diagnosis. Get a diagnosis. I treated a baby a little while ago who had seen some other practitioners, and I treated the baby. The baby had gone through a few weeks of hell and had been to other practitioners that were treating the baby. The baby wasn't getting better. The baby was having feeding issues, and the baby had things that I saw in the first treatment that had, I don't know, not been addressed or whatever. I had to refer for some extra support. So we got extra support for the baby and the mum. But I have a diagnosis, and I don't have a complete diagnosis. I have an initial diagnosis that is to be tested. It's tricky to test it because it's a baby, and the baby is older and has had trouble for a while. So we're in a process. Diagnosis is supportive. Practitioners should be supportive. If they're not supportive and they're not diagnosing you, demand it. Demand it. Talk to them. They're probably scared. They have the skills. We all have the skills. New grad osteos have the skills. New grad osteos have been learning this their whole 5-year degree, and they've been in clinical practice in student clinics mentored by qualified osteopaths for 2 years before they graduate. So they've got this. So just demand more. Demand a diagnosis. What's my diagnosis? What are you thinking of me? What's going on? Tell me what's going on. Have a chat about it and be okay. Hey, thank you for listening. Stay happy and well. And big hugs. Big hugs. Bye.